Feeling like your antidepressant is doing more harm than good? You're not alone. For the first time ever, a comprehensive ranking of antidepressant side effects has revealed shocking differences between commonly prescribed drugs. This groundbreaking research could revolutionize how we approach mental health treatment, but it also raises some serious questions about current prescribing practices. Imagine a world where your antidepressant is perfectly tailored to your individual needs, minimizing unwanted side effects and maximizing its therapeutic benefits. That's the promise of this new study, conducted by researchers at King's College London and the University of Oxford. They meticulously analysed 151 studies encompassing over 58,500 patients to rank 30 commonly used antidepressants based on their impact on physical health within the first 8 weeks of treatment. The findings, published in The Lancet, are eye-opening. But here's where it gets controversial. While antidepressants can be life-saving for many, the study highlights the often overlooked physical toll they can take. For instance, agomelatine was linked to an average weight loss of 2.4 kilograms, while meprogyline led to nearly 2 kilograms of weight gain during the initial 8 weeks. Heart rate variations were even more dramatic, with a 21 beat per minute difference between fluvoxamine, slowing the heart, and nortriptyline, speeding it up. Similarly, blood pressure could swing by as much as 11 millimeters of mercury depending on whether you're taking nortriptyline or doxepin. Around 8 million people in the UK alone are taking antidepressants, making this a widespread concern. Professor Oliver Howes, a lead researcher, emphasizes that these differences, even seemingly small ones, can have a significant impact on public health given the sheer number of individuals affected. This isn't about demonizing antidepressants, it's about empowering patients and doctors with the information needed to make informed decisions. The study underscores that no two antidepressants are built the same, as Dr. Athishana Rumaham from King's College London aptly puts it. These seemingly disparate side effects can accumulate, potentially increasing the risk of serious health issues like heart attacks or strokes, especially in the long term. To illustrate, consider 3 hypothetical patients, Sarah, John, and Jane. All 3 are diagnosed with depression and prescribed antidepressants. Sarah is concerned about weight gain, John has high blood pressure, and Jane struggles with elevated cholesterol. According to Dr. Toby Pillinger, each would benefit from a different antidepressant. Sarah might be steered towards agomelatine, sertraline, or venlafaxine, while John would likely avoid venlafaxine, amitriptyline, or nortriptyline, opting for citalopram, escitalopram, or paroxetine instead. For Jane, citalopram or escitalopram might be preferable to venlafaxine, duloxetine, or paroxetine, which are linked to higher cholesterol levels. And this is the part most people miss. The researchers aren't suggesting that some antidepressants are inherently a good or a bad. Amitriptyline, for example, while associated with weight gain and increased heart rate and blood pressure, can be effective for pain management and sleep disturbances. The key is to match the drug to the individual's specific needs and health profile. The most commonly prescribed class of antidepressants, SSRIs, like paroxetine, citalopram, escitalopram, and sertraline, generally exhibited fewer physical side effects. Flaxetine, Prozac, another SSRI, was associated with weight loss and increased blood pressure. However, Professor Andrea Cipriani from the University of Oxford points out that a push for generic, cheap medications has led to a situation where 85% of antidepressant prescriptions in the UK are for just 3 drugs, citalopram, sertraline, and flaxetine. He believes that implementing the findings of this study could dramatically reduce this percentage, giving more patients access to more appropriate treatments. To facilitate this, the researchers are developing a free online tool to help doctors and patients navigate the complex landscape of antidepressant side effects. However, implementing this personalized approach would require a significant shift in culture within healthcare systems. It's crucial to acknowledge that this study focused on the first 8 weeks of treatment. While researchers believe these short-term changes are likely to persist, further long-term studies are needed to confirm this. Dr. Prasad Nishtler from the University of Bath highlights that the long-term cumulative risks could be even higher, especially for individuals with chronic depression. What do you think? Should doctors be more proactive in discussing potential side effects with patients before prescribing antidepressants? Is the current emphasis on cost-effective, generic medications hindering access to more personalized treatment options? Share your thoughts and experiences in the comments below. Have you experienced unexpected side effects from antidepressants? What factors would you prioritize when choosing an antidepressant?